everybody gets screening for cancer at some point in their lives. And usually it's later in life because that's when most people develop cancer. But we know that if you have certain family history or personal risk factors, including, knowing that you have a genetic variation that predisposes you to getting cancer, we know that people benefit from earlier screening or more frequent screening. So that's a lot of what I do is I coordinate the different types of screening that people need. And the idea is that we would be able to find a cancer early when it could be potentially just surgically removed and easily treated, so that it wouldn't lead to people having, an aggressive cancer that requires a lot of invasive treatment. There are guidelines for who should get genetic testing. It's largely based on if someone has had cancer, what type of cancer they had, how young did they have the cancer diagnosed, what type of cancer was it, and also based on their family history. That being said, oncologists should be familiar with guidelines for who should consider inherited genetic testing, and also general practitioners should also be familiar with these guidelines. That being said, if anybody has questions or they're interested in genetic testing, we offer counseling about considering genetic testing, the risks and the benefits, and it's something that we're happy to offer to really anybody who's interested in getting this type of inherited genetic testing done. The real benefit in knowing about your own personal genetic risk factors for cancer is that you can do something about it. We know that people with these genetic variants benefit from heightened screening, and then we can also similarly, when patients' children become a certain age, they know that their children are also going to benefit from that as well. And I think that's really relieving for people, especially people who have been through cancer and want to make sure that their children can, avoid that to the extent that they can. So there's real benefit for the whole family to participating in this kind of, genetic testing and surveillance. I perform this heightened surveillance or screening using CAT scans or MRI or other imaging methods. We regularly find, early stage cancers that we're able to surgically remove and treat without the need for chemotherapy or other types of more aggressive of therapies. And those cancers presumably would have, grown and become much more difficult to treat had we not done that type of early monitoring and close surveillance. A lot of the research in my lab focuses on trying to apply targeted therapies based on someone's genetic risk factors to prevent people from getting cancer. And I think that's going to be an increasing reality for more and more people. In my group, we already have clinical trials using targeted approaches based on someone's genetic makeup. We're doing that now for people that are at high risk of leukemia. And I think we'll be able to increasingly offer that for other types of cancers as well. When I was in college, I realized that I was interested in science, but I also knew that I wanted to be able to do really translational things and be able to help people in a more immediate and direct way. And so that's why I got interested in medicine. And so now I think I have the best of both worlds. I see patients that have conditions that are directly impacted by my research. And, I make those personal connections with patients and their families, but also I have the feeling that I'm advancing science and hopefully making things better for, future patients as well.